Dr. Robert Murphy, Executive Director of the Institute for Global Health, and then John Philip Fair, Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions each Tuesday and Thursday here on the Institute for Global Health's Facebook page. And we invite you to continue to submit your questions via Facebook at NU Institute for Global Health or directly via email at globalhealthinstitute@northwestern.edu. And leading the discussion today again is Katie Berg, who is an intern this summer with the Institute. And Katie, I now turn it over to you.
Thank you so much, Kristen. And thank you all so much for joining us and for continuing to submit questions. We really, really appreciate it. We're going to start today with the biggest news of the week, which is that health officials have announced that COVID booster shots will be available later. And Dr. Murphy, can you tell us when those booster shots will be available to the public?
Well, there's two sort of levels of booster shots or third dose. So one level is already approved. These are immunocompromised patients, which includes kidney transplant patients, people on chemotherapy for cancer, people on high dose steroids or any immunosuppressant drug. They have emergency use approval to get a third dose of an mRNA vaccine today. I mean, it's been going on for a little while. So, and they should go and get that now because they have probably not mounted a good enough response with the 2 doses they received already. So they should get their third dose now. The second thing is what was spoken about in the last 2 days, in that it looks like the effect of the vaccine, especially with this Delta variant, begins to wane significantly at 8 months after the second dose. So in order to boost the response, improve that response at 8 months, the FDA is most likely going to allow this in about 1 month's time. So that will be people who got their second dose in January to get a third dose. This would be a true booster shot. It's the same vaccine and it's just 1 shot. And they will get that. And that's everybody. So in other words, the effect of the vaccine has dropped enough to warrant a third shot. And this is done with other vaccines. We get a different flu vaccine every year. We get, measles, mumps, rubella vaccine boosters every once in a while. There's all vaccines often need boosting. So this is not really unusual. It is the exact same vaccine. So that's going to start in mid-September. And people who had their second vaccine in January go to the front of the line. So if you think back to just to January, that was mostly nursing home residents and healthcare workers. So that, as the vaccine rolled out, that's how the people are going to receive this dose.
Mm-hmm. And why has the city of Chicago implemented a new mask mandate?
Well, that's all just based on the numbers, and the numbers are high enough to take a step back. And for indoors, which includes indoor dining, any kind of indoor events, weddings or whatever. And we're coming into the fall season. There's going to be a lot more indoor stuff happening. Masks have to be worn and social distancing should be done. And it's a good idea that they're taking this step now. We know these mitigations, masks and social distancing, we know they work. They have worked every time there's been a spike, even before the vaccines came out. So it's good to do it on the early side so we don't have the big problem like they have in many under-vaccinated states.
Mm-hmm. Now switching over to some of our viewer submitted questions. Our first viewer, was wondering that because the J&J vaccine has a lower efficacy rate compared to the mRNA vaccines, does someone who got the J&J shot have a higher chance of hospitalization from COVID?
Actually, no. Although they have a higher chance of getting a symptomatic mild to moderate infection, they don't have a higher rate of hospitalization or death. As a matter of fact, if you look at it just on a shot-by-shot basis, the Johnson & Johnson vaccine has the best response after 1 dose. 1 dose of either the Moderna or Pfizer are not as good as the Johnson & Johnson. But then after the second dose of the Pfizer and Moderna vaccine, they get a much better response. Now, there just happens to be a 60,000 person trial that's just finishing up of 2 doses of the Johnson & Johnson vaccine. And those results, the rumor is, should be pretty soon. And we will see what 2 doses of the J&J vaccine will do in the long run. So that's basically the status of that right now.
So a viewer and their spouse had a COVID-safe wedding previously this year outdoors and have planned to have their reception in the future with around 100 guests indoors, but all guests will have proof of vaccination.
Mhm.
They're using about half of their venue capacity so they can have social distancing in place. But given the rise of the Delta variant, the couple wonders if they should implement additional precautions such as testing guests or requiring masks.
Well, according to the new guidelines in Chicago, and these guidelines are very reasonable and would really apply to almost every place around the United States right now and many other countries, is that because it's an indoor event with a big group, even though they're all vaccinated, they should, other than when they're eating, use masks and socially distance. And so it sounds like this group has planned very well. You know, the event space is big, people can spread out and the like. So they should do that. Now, can they do anything else? Yes. Well, they've already done, they've basically mandated vaccine only people to come to the wedding. So that's good. If they want to go an extra couple steps, I can tell you what some other groups are doing and companies are doing. These are not in any written guideline anywhere, but there are some steps that people are doing. One is they could ask the guests to have a molecular COVID test within 72 hours of the event. And this would pick up potentially some asymptomatic people and keep them out of the event. So that's one thing. It's the same thing happens when you try to travel anywhere internationally. You know, you have to have proof of the test, or in many other situations, you have to have proof like this. So you could do that. And then if the event does go over a few days, say it's a Friday night and Saturday and Sunday, whatever, you could actually have the guests do a over-the-counter antigen test. They take 15 minutes, people do it themselves, they get the result right there. If they're positive, one of the problems is that it could be a false positive, but they could get a molecular test, like a PCR test, to confirm that. And some of those are available now with results in as little as 30 minutes. So, you know, all this is possible. So it just really depends on the level. It sounds like this is a very responsible group running this wedding. And I think an approach like that, I think people would even feel more safe.
Mm-hmm. Another family has had their first dose of COVID vaccinations, with their second scheduled for later in August, and they also had COVID back in November. The couple, however, has 2 children that are not yet eligible for vaccination, and a worker in their home who is working on a remodeling project has recently tested positive for COVID. Should their family get tested, and what quarantine protocols should they follow?
Yeah, no, this is, we're back to the same old thing we were doing a couple months ago. So, you know, they've been exposed to somebody. They should quarantine for 10 days, whether they're vaccinated or not. So the whole family, but they can get out of the quarantine before 10 days if they have a molecular test, usually by day 7. Some people do it as early as day 5, but by day 7, they can get out. Like here at Northwestern, that was actually the policy last year in the people that had an exposure like that. They went into quarantine. They had a whole protocol about testing them. And then day 7, if they were negative, they get out of quarantine a little bit early. But we're basically going backwards.
Right. And is there a correct order to receive a COVID booster shot and a flu shot when that booster does become available?
No, it's whatever one comes up first that you're eligible to get or able to get. And remember, there's a kind of a loose recommendation to keep them about 2 weeks apart. That's just to remove the overlapping side effects. Mm-hmm. And so, you know, there's no magic to waiting 2 weeks, but most people wait 2 weeks.
Right. Another viewer's family is getting married in October in the St. Louis area, and the viewer has a 7- and 9-year-old children who are in the wedding party, but because of the Delta variant, they are nervous and are wondering if they are correct in telling their family that the children should not attend the wedding because they are unvaccinated.
Well, yeah, you should not be planning events with vaccinated and unvaccinated people together. I mean, that is just high risk. Unfortunately, all the children are going to be unvaccinated. Now, that's going to change, and it could change actually before October, whereas kids, it's likely, we'll see, that 4 to 11 will be given EUA, emergency use authorization, to have a vaccine. Now, I don't know if they could get both the doses of the vaccine in there, but that's coming in the future at some point. And by the end of the year, the data from the 6 months to 4 years will become available, and they too may get EUA, emergency use authorization. So, you know, by the end of 2021, basically everyone can be eligible to get a vaccine. And then for adults 16 and over, full FDA approval is expected literally any week now. And then you'll see the full approvals follow kind of in the order that those groups were tested. But that's going to take like another year for all that to happen. So this group in St. Louis, I mean, Missouri is in terrible shape. And they have a lot of problems, and the unvaccinated should not go to the wedding. And if there's not a vaccine mandate for everybody there, I mean, even these people shouldn't go.
Mm-hmm. We have another wedding question that's in a similar vein. I have a feeling it might have a similar answer, but a viewer and their family are vaccinated and are deciding on whether to attend the viewer's spouse's oldest child's wedding, next month in Southern Illinois. And the stepchildren and ex-spouse, as well as many of the guests, are unvaccinated, and the wedding is indoors. What concerns should they have about going to the wedding, and should they go?
Well, you know, in many counties in Illinois, particularly in the southern part of the state, but not limited to the southern part of the state, there are so many unvaccinated people and people against the whole vaccination process. This is a dangerous time to mix vaccinated and unvaccinated people with this Delta virus. So I think that people should really think twice about even attending the wedding. If they go, they need to really make sure they have a good mask and stay, you know, at least 3 feet away from everybody while they're there. And, you know, you're still going to have a risk, because I bet a lot of these people are not even going to be wearing masks, and you're going to be around them. That's even worse. So this is an unfortunate situation that doesn't have to be, you know, these, I mean, we know the data with the vaccines now and the safety and the efficacy, and, you know, there's really kind of no excuse to having this large number of unvaccinated people in terms of, you know, it's a pandemic.
Mm-hmm. So how safe would you say an outdoor event is where vaccinations are required?
Well, I mean, look at Lollapalooza. I mean, 400,000 people approximately attended that. We were expecting, a lot of people predicted big spikes in the number of cases and hospitalizations of young people, and like they see in the unvaccinated, low vaccine uptake states in the South, you know, all these people in the ICU in the 20s and 30s and, you know, 40s. And that hasn't happened. The preliminary, you know, the first data coming out of Lola is that, you know, there were a couple hundred extra cases, and nobody was really that sick. Remember, they were jammed on the metro cars and buses and, you know, all at the event itself. So that hasn't turned into the big super spreader event that many people had predicted. Now, there's a lot of problems with that, but, you know, that's a good example of a very large group that mandated vaccines or a test just before you got in. And, you know, it probably attracted people who had been vaccinated, and probably a lot of people that couldn't take the vaccine or didn't want to take the vaccine, actually, maybe they stayed away. So there's a lot of social behavioral issues involved in that. But one thing for sure, right now anyway, it doesn't look like it was like a big huge super spreader event. So that's very good news. 88% supposedly had been vaccinated. Okay, maybe that number's off by some points. I'm sure some people, had a fake test, although it's illegal. But but still, they're not seeing the number of cases, and that's a really good sign. And hopefully, that's going to be the wave of the future. If we can get up to 90% vaccinated, we can pretty much go back to normal.
Right. That is really great news.
Mhm.
Our final question comes from a viewer who is wondering why the Delta variant is so transmissible, and should they be worried about getting exposed and potentially giving it to their unvaccinated children?
Yeah, the Delta variant, the virus is very clever. It's just a high throughput production machine, a disease machine. And it's such a dynamic process that it is constantly mutating. And this is nature, okay? And so the variant, the Delta variant, is highly contagious. It's changed its shape, the way it gets into the cells, and it's just very easy. The exposure that a person has to be considered high risk, it used to be 15 minutes in a 24-hour period that you were exposed to a person who was infected. Now it's less than 1 minute. So that just shows you how contagious this thing really is. Most likely, everyone that's unvaccinated is very likely to get infected at some point in the next couple of years, either with Delta or whatever comes after Delta. And so this includes children that aren't vaccinated. So the governor of the state of Illinois has mandated that all schools, public and private, everyone should be wearing masks in there, whether they're vaccinated or not. And it's because of this Delta problem. And we know that these mitigations work. They work every other time. Why wouldn't they work now? So, people are fighting this even in the state of Illinois and other places, because I don't know why, but, that is going to keep that pool of unvaccinated people is going to keep this thing going forward. And that's very unfortunate.
Mm-hmm. Well, thank you so much for your time, Dr. Murphy. Thank you for answering all these questions. And thank you so much to all of our viewers and to Kristen for putting this all together. We appreciate you. Thank you very much.
And thank you, Katie, for all your help this year.
I've loved it.